right now I'm going to tell you about COVID-19 and about children. Now, 2,180 children have contracted COVID-19 since the country first recorded its first case in March. That's according to a report by Child Rights Advocacy Group. Now, Child Rights International is what I'm talking about. The report further reveals that more girls have contracted the virus as compared to boys. However, more boys have died from the virus than girls. We'll be hearing from Executive Director of Child Rights International, Rights Int'l, who earlier today at a press conference urged government to intensify its campaign so children understand the importance of observing COVID-19 safety protocols. But first, let's show you excerpts of that particular research. I'm going to just quickly take you through these slides that we have from Child Rights International. Okay, so here it is. 2,180 children, as you've seen, we rightly mentioned, have contracted COVID between 11th of March and 9th of November. And 1,161 out of that 2,180 are girls, and that accounts for 53.3%. Well, you could say that that's because there are more girls in Ghana than there are boys, but we'll get Rights Int'l to help us understand what that statistic is pointing towards. And 1,019 of that number are boys, and that accounts for 46.7%. Let's go to the next slide. Take a look at what it says. Now, majority of the children infected fall within the ages of 0 to 14. 14 between 15 and 17 contracted the virus. So people between 15 and 17 contracted the virus. I think I need a little bit of clearance there. I'll get to Bright to give me that. But the next point is that 4 children have died from COVID-19. 3 of them, like we indicated earlier, boys. And 8 of every 10 children interviewed preferred to be in school rather than to be at home. We'll talk about that also shortly. Let's take a look at the final slide that says only 5% of children in the regions have access to digital platforms. That's when it comes to getting themselves educated in the times of COVID. And 2 out of every 5 children have experienced some physical abuse and maltreatment. About 5% of these children have also experienced maltreatment once or twice a day. Rights Int'l is joining me right now via Zoom, and we'll engage him more on these statistics. Bright, it's good to have you. It's been a while. I trust you're doing well.
Yes, I'm doing very well.
Okay, so
I hope you're also doing well.
I am blessed. So, looking at these statistics, first of all, let me start from the population that you dealt with, the population from which we got this sample. Then we can narrow it down to COVID.
Yeah, for the primary data, we surveyed 589 community cities and towns, which we dealt with about over 4,000 people, including children, parents, and yes, both parents and children. So on the basis of that, we got the primary data that we did the extrapolation and all. But from the COVID one, we got the data directly from Ghana Health Service in all the facilities that deal with COVID. Okay. And these are the outcomes that we got as a result of that. So if you look at the approach that we used, we collected primary data, and then we also got data from Ghana Health Service. And then we also looked at other work that has been done by people from other jurisdictions, especially those who populated the contraction of COVID to be able to do our work. So these are the 3 areas that we used to come up with a report.
So in just very brief and maybe one line, tell me how this 2,180 number of children who contracted COVID-19 compare to the other countries. How does it compare? Does it make us better off?
Well, in terms of for the contraction rate, I think we are one of the lowest in all over the world.
Yeah.
And that also depends on the kind of population that they have. Because if you pick France, you pick UK, US, and even India, you realize that our figure is very, very low. And even within the sub-region of Africa or West Africa, ours is very, very low. And I think that it's a good sign, but you'd also tell us that we need to do more to be able to protect children. And even if you look at those who died, I think that if you are to do a relative comparison, I think we are better off.
Okay, but well, at least 4 children have died. I don't know what that what that means, but you also realize that children were, you know, maltreated. Some of the children were maltreated, and that's because they were at home. And so most of them, according to your research, survey say they would rather be at school than be at home. And that's why I believe in your conclusion, you're calling on government to do more. Let's go through the expectations that you have of government on the back of these statistics.
Yeah, well, we did, when we did to establish the incidence of COVID among children, and then looking at the contraction rate, we thought that something else must be done to be able to come to a certain conclusion. That is why we also look at the state of children at home. So clearly, based on the report, you realize that most of the students do have trust in our school system as compared to the home. So they feel that staying at home will not be the appropriate or a safer place for them, but they feel that going back to school will solve their problem. So clearly, most of them are demanding that they go back to school. That is why we are saying that it is important for us to look at the outcome of the data from the clinical point of view to be able to determine 2 things. First, to know whether children are potential transmitters of the COVID among their age cohort, and then also whether they are a threat to the vulnerable groups. If you are able to determine that, then the option for us to do, if children can carry the large volume of the virus, for that matter, it is easy for them to transmit it, then a decision of making the home a learning center should kick in. Or if they carry the low and they cannot transmit it, then government must begin to look at how to open schools in a manner that students will observe the protocol. So these are the things that are coming up. And students staying at home, based on the report, I think that it is causing more harm to them than we thought. And we also felt that though government is doing much, the corporate environment has also neglected its responsibility. Because if you look at one of the outcomes, you realize that about 6 out of 10 children say that they spend more than 6 hours at home without any supervision, which means that their parents are not present and not a guardian even present to take care of them. So you can imagine if children are spending 6 hours a day at home without any supervision, you can imagine what they can do within that period. So a call for a very comprehensive system that, for me, the state, not government alone, but the state must also be interested in doing things in a manner that would ensure that we don't make children more vulnerable.
Right, I'll say a very big thanks. This looks like it needs a whole panel of discussions to be able to, to reach out to all these stakeholders. Very important issue. Bright, thank you for this survey. Bright Apia there, who is with Rights Int'l. They've done some very good research there indicating that children want to go back to school. Perhaps we need to put in those measures for them to do so, because he says it's causing more harm than good having them stay at home.